Good morning. This is Linda Taylor. I am a Medicare career agent with United Healthcare. And today I'm going to be talking about how Medicare works. It is the first of three parts of our Medicare and how it works meetings. I hope you enjoy it. It is a strictly education meeting. The book I'm going to use is put out by United Healthcare, but in no way does it, show anything about United Healthcare or the plans. It's just talking about how Medicare works. My name is Linda Taylor again, Taylor Your Insurance. On the first page will be my phone number and email and website. You can look at it, and if you need to call me, be sure and do that. There is the link to Medicare Made Clear that you can download and follow with me, or there are hard copies at your local library, Rolla Public Library today. And if you, this should be up all the time. And if you need to share with anybody, or if you want to look at it again, feel free to do so. Okay, we're going to start Medicare Made Clear. If you can turn to page 4, we'll start there. Who can get Medicare? Any U.S. citizen and legal residents. Legal resident has to be here at least 5 years, and they have to have had worked there a certain amount of quarters to qualify for Medicare. And they have to be a legal U.S. citizen or have the legal residence card. You must meet one of the following: 65 or over, younger than 65 if you have a disability. There is a qualifier there. You must have been disabled for 2 years or have end-stage renal failure or ALS. Now, sometimes the courts take you back 2 years, so it depends on whether the judge gives you a backdated disability or not, whether you can get Medicare. So that's something, to be aware of, that even though you just get your disability check, if the judge takes it back 2 years, then you can go on and get your Medicare. And if you have gotten this card, Medicare health insurance, your red, white, and blue card, we call it, and it has parts A and B on it, then you're, golden. You're ready to apply for Medicare. So that's the big thing if you've gotten the Medicare card. Many people who have worked and turned 65, they'll go on and get this card sent to them. If you maybe didn't get your quarters, but your spouse has done their quarters, sometimes you can get Medicare off of your spouse. So there's different ways to do it. And Social Security is the place to call, or go online, ssa.gov. Social Security Administration, ssa.gov, and everything is right there to help you. Or you can call me and I'll walk you through it, or email me or text me, whatever you want to do. Now, there are some special things if you want to work past 65. There are all kinds of things that you can do there. You'll get A because you worked for it. Now, some people say, oh, A is free. Well, no, A is not free. If you didn't work those 65 quarters, it's quite expensive. Those quarters that you need to have qualified for A, not 65 quarters, it's 20 quarters. But anyway, it did cost you many years of working, so it's not free. You don't have to pay at 65 because you've already paid. If you remember those little Medicare taxes on your check, well, you were paying into Medicare all that time. So those are things we'll talk about later, and you can read about them. Those take up a lot of time. We don't have to do right now. So A pays for hospitals, inpatient care, hospice, different things like that. So you can just remember that A is kind of like a hospital insurance, where if you go inpatient, your A is covered, but there is a deductible. And it changes every year. So I'm not going to go into how much it is, but there is a deductible, and it is in the book. And each year it is different. but every 60 days you can have a deductible. Now, if you're in over 60 days, you can have a copay per each day. In section 3 or part 3 of the video series, we'll go over copays and deductibles. So anyway, part B, you do have a premium for part B, and that covers your doctor visit, outpatient care, chemo if it's done in an outpatient clinic, outpatient surgery. If they put you in the hospital under observation, that goes under part B. So A, hospital, B, doctor visits is an easy way to, remember it, but there are a lot more things to it. So anyway, that's just how people remember it. And if you notice, there is a date by your hospital A and B, and there's a lot of down the road, if you try to get different plans, it may be important on when you turn 65 and when you got your part B, but those are things that we don't need to discuss right now. So there are 2 ways to get Medicare coverage. Now, your Part A and your Part B, those are parts of Medicare. They have no cap on them. Your deductible and your copays, they have no cap. So most people need something to help them pay for those out-of-pocket expenses for Part A and Part B. One option is Medicare supplement, which that's usually just in case. You pay money up front, and when you go to the doctor, on many of the plans, you don't pay very much, if anything. And you do have to have a Part D for drug plan with it. So there's A plus B plus D are 3 plans you need to have Medicare, because without a Part D for drug plan, your drugs would be extremely expensive. So the supplement picks up what Part B and Part A, the copays and the deductibles that they have, it picks up. There are a couple things: Medicare assigned doctors and Medicare approved expenses or procedures. Now, those are things that Medicare, you can't get paid by Medicare unless they're an approved procedure or a Medicare assigned doctor. So you always want to remember that. So, but Medicare supplements usually don't have a network. So a Medicare supplement is not a network, and unless it's not a Medicare assigned doctor, which most all doctors are now, or it's not approved by Medicare. And then the Part D, you have to get that with it. The other option is what they call an Advantage plan, and that's actually Part C of Medicare. So you've got Part A, hospital, Part B, your drugs, Part B as in boy is your doctor visit, Part D is your drugs, and then Part C combines A plus B plus D, and it's called Advantage Plan or Part C. I know it's confusing, but this little graph right here or illustration is the best one I know to help people. Now, option one is just in case, and you pay as you go. Actually, you pay up front. And option 2 is like you're used to in regular health insurance. You've got co-pays and deductibles, and if you go to the doctor, you pay something, or maybe not, but most of them, you go to the hospital, you pay then. So you kind of, but you've got you pay as you go. You can have some expenses, but you've got a cap on it so that you're never you have a cap, so you're never going to be like regular A and B and have no cap, where you can be extremely in the hole or have a lot of expenses because there's no cap on A, B. So C combines A plus B plus your drug plan, all in one Advantage plan. Now, there are networks, and in part 3, we're going to talk about HMO as opposed to PPO, but we're going to talk about that later. So, option 1, no networks, pay up front, no surprises. Option 2, you have networks, and you pay as you go, as you have to enter the hospital or whatever. Hopefully you don't have to enter the hospital, but you do that. Okay, and we're going to skip some of these things, and page or section 3 of these videos, we're going to go back and talk about those. Okay, we're going to skip on down and come back to that in section or part 3 video. Okay, let's go to page 12. Whoops, I missed it. Okay, page 12. This tells you more about part A. And I'm not going to go through all of that, but again, the actual expenses of part A. Now, most everything that's in the hospital is covered under part A. Now, things that aren't are personal expenses while hospitalized, such as TV or phone. Now, the things that aren't covered under A2 are custodial care, like if you have to have somebody help you with personal daily life activities like eating or bathing. And long-term care is not part of Medicare. You get 100 days in a skilled facility, but after that, you're on your own. Many people, go to Medicaid at that time because they haven't made arrangements, but there are different ways to approach long-term care, and but you need to do, think about something, or a lot of people go on to Medicaid because it's so expensive. But there are only 100 days of long-term care. Most care outside of the United States is not covered. Days spent in a psychiatric hospital beyond certain limits, and hospital days beyond certain limits are not covered. So you just need to know what's not covered. And then part B that's not covered are eyes, ears, teeth, and usually feet are not covered. And of course, A and B don't cover prescription drugs, and that's why you have part D, and that's on page 13. So the things that aren't covered are your home health, only after a little bit after your surgeries, but care like bathing and helping you eat and stuff, that's not covered under Medicare. Go back to page 12. The custodial care, they call it, TVs and phones and those things in the hospital. Long-term care, most of the time, care outside the United States. There's a certain set of amount of days in a psychiatric care, and after so many days in the hospital, you're not covered. Eyeglasses, hearing aids, hearing tests, dental exams, and most prescription drugs are not covered unless they're under Part B. Now, Part B, doctor visits, annual wellness, clinical visits, physical therapy, diabetes screenings, mental health, durable medical equipment like your chairs and stuff, ambulance, emergency room. That's all under Part B. But Part B only pays 80%. So 20% of that stuff, outpatient surgeries and stuff, can be quite expensive. So then you need to, most people, get another plan that can help them on the Part A deductibles and copays and the Part B deductible and copays. So that can be a lot when there's no cap on it. A lot. Outpatient surgeries are a lot. Okay, here we go. We're going to skip to page 16. These you can go back and read on your own. And this year, the standard monthly premium for 2020 is $144.60. Now that changes every year. 2020, that's what it is. It changes every year. You pay that usually out of your Social Security or Railroad Retirement, and it's billed directly from that. There are some ways if you were enrolled earlier than that, but this year it's that amount. And there is a $198 deductible in 2020. But when you go to the doctor, you have to pay 20% of what the doctor charges beyond that 198. Now, again, there's no cap on original Medicare Part B, just the same as original Medicare Part A. No cap on it. So that's something to be prepared for, and that's why a lot of people have the extra amounts. And I did forget let's go back to 14. I'm so sorry. Original in 2020, if you didn't work your quarters, that would be a $458 cost, and the deductible is $1,408. Every 60 days that you go, if you came out of the hospital and went back in, you'd have to pay that. Or if you're in the hospital more than 352 days, you've got 300, excuse me, more than 61 days up to 90, 352, and then $704 per day after that. So you can see how terribly expensive it is if you don't have anything to help you with those days. And the skilled nursing is so much per day after 20 days. So can be very, very expensive. So that's why most people get something, either option 1, a supplement, or option 2, an advantage plan, because it can just mount up to thousands and thousands of dollars if you don't have some kind of a stop loss on there. And I'm sorry, I did pass up A. I am so sorry. But that's the A, and then the B, your deductibles and coinsurance for 2020. Okay, and you can kind of look at how they are. Now, Part C, we'll get into more on the third portion of our videos, but they usually add some more things, but we'll talk about more Part C on that one. Okay, if you can turn, actually, we're kind of at the end of this segment. Came up closer than I thought. It's a good place to stop. We talked about A, B, and D. A being the hospital, B being the doctor visits, D being the drugs, and C is A plus B plus D equals C, or an advantage plan. So we've gone over a lot of things to start with. I don't want to get you confused. I want you to take it in parts, a little bit at a time, so you can understand. Now, my phone is always on, 573-578-5333. I'm Linda Taylor, Taylor Your Insurance. I'm right in Rolla. I do work all over the state virtually. Right now, I'm staying home. I'm old, and I don't want to get sick, but I can do everything over the phone. Any way you want to do it. If we need to meet in person ever, we can meet outside or something, but to talk. But if you need questions or just questions, or call me, and I can try to help you with how Medicare works. Again, this is a strictly education meeting, and just ask me questions if you want to, and I will be happy to try to answer them. If I can't, I will refer you to somebody that can, or I'll make a call. Medicare has it's pretty cool. It's got an app that's just Medicare app, and it answers a lot of questions. To me, this Medicare Made Clear book is just wonderful, and you can again pick it up at the Rolla Public Library or a library near you, and you can use the link to get it. I'm here for you. I appreciate you listening today, and really look forward to meeting you sometime or seeing you. Hope that this helps you understand Medicare, the first part, a little more. We're just going to take it in bits. Thanks so much for joining me today. It's a wonderful day to talk about Medicare. Thank you.